Support for Colorado Today comes from Credit Union of Colorado. With access to over 30,000 ATMs and a mobile app, they're dedicated to offering the services of a big bank with a heart. Learn more at honestlygood.org.
Support for Colorado Today comes from Safeway. Their pharmacists are here to help, offering a wide range of vaccines including flu, COVID, pneumonia, and RSV immunizations. Visit your local Safeway or schedule online at safeway.com/pharmacy.
Happy Monday, happy last day of summer. I'm Arlo Perez Esquivel.
And I'm Bazi Kanani. Coming up, RFK Jr.'s new vaccine panel and physicians make different recommendations for what shots you, your kids, or your parents should get.
The confusion and uncertainty for families and for providers, I think, is unprecedented.
Find out how the changes could affect families here.
Then, a construction worker and her son were put in ICE detention. They're grateful to be back in Colorado now.
Me gustó mucho jugar en el play otra vez.
But they are among hundreds held without criminal records.
Plus, a restaurant where you can pay whatever you want to pay.
I found Sane Cafe at the onset of the pandemic, and I've been hooked ever since.
It's Monday, September 22nd. Here's the news in Colorado today. The CDC's vaccine recommendation panel just finished up 2 days of debate and decisions that will have effects on vaccine supplies and availability here in Colorado and around the country. CPR's health reporter, John Daly, he listened in and he's talked with local healthcare providers to sort out what that means for you and other families here. John, we're going to be mostly talking about what's going on with the COVID shot. But first, briefly, what was the meeting like? And what else should we know about that happened there?
I have to say this meeting was extraordinary because it now has a lot of new members, some who are skeptical of vaccines. And it was a really chaotic scene at some points. The panel did change the recommendation for a combined shot for MMRV, that's measles, mumps, rubella, and chickenpox. This pertains specifically to children under age 4. The CDC will not recommend that combined shot anymore. Instead, they want kids to get the MMR shot and chickenpox vaccine separately. I asked Sean O'Leary about this. He's a physician at CU Anschutz and is a leader with the American Academy of Pediatricians. He chairs the Committee on Infectious Diseases there. He calls the move on the MMR vaccine reckless. He says these moves are having real-time impacts. Just last week, he heard a story from a colleague in primary care about a parent declining an MMR vaccine.
Because of what she heard on the news about this committee sowing fear about an issue that was settled literally over 15 years ago.
The American Academy of Pediatrics continues to recommend the MMRV vaccine as an option for families. So you can see this as an example of where this panel, under the leadership of Robert F. Kennedy Jr., is veering away from what major medical associations recommend. And the fact is, most families in Colorado already use 2 separate shots to protect their kids, according to a state health department spokesperson. But she admits changes like the CDC made can sometimes lower the rates of how many people complete all their shots.
Okay, and moving back to the COVID vaccine, what has been the rule thus far for the COVID shot, and has that rule been affected by this?
Well, there has been a broad CDC recommendation for COVID-19 vaccines. They're proven to lower the rate of hospitalization and serious illness and lower your chances of getting long COVID. Over the past few days, the CDC panel has weakened these recommendations somewhat, but not thrown them out entirely. So the CDC says people over 6 months old should make the decision whether to get a COVID-19 vaccine with a doctor or other healthcare provider. And the weakening comes in with a new, quote, emphasis that the risk-benefit of vaccination is most favorable for people who are at an increased risk of severe COVID-19 disease, but their recommendation would not bar anyone over 6 months from getting the vaccine. If you want it, you are still eligible.
Okay. Do the major medical associations agree with the caution about who to prioritize and to consult a doctor?
No, they still broadly advise getting a COVID vaccine. Colorado's health department has endorsed updated COVID-19 vaccines too, but with this guidance about making decisions in consultation with your doctor. In Colorado, you do not need a prescription from a doctor to get the COVID vaccine at a pharmacy.
That's a really important point that we should really remind the listener. You do not need a prescription in Colorado. So then the big questions are, for the people who want to get a COVID vaccine, will they be able to find it, and at what cost?
Yes, I think you'll be able to get it here in Colorado, but you could see a two-tier system develop where you can get it if your insurance covers it, or you can afford to pay for it out of pocket. A federal program called Vaccines for Children supplies hundreds of thousands of doses for Colorado kids whose families can't afford them. It's not clear yet, though, if that'll continue. That'll depend on what the federal health agency decides. Here's Dr. Bob Belknap. He's chair of the Public Health Institute at Denver Health.
If public health agencies and providers are unable to access those VFC vaccines for children, then that's going to make it very difficult.
Especially low-income families. The cost of a coronavirus vaccine, he says, is about $165. A lot of clinics are still waiting to see what vaccines they'll be able to get through VFC. For people who do have insurance, a National Health Insurance Coalition said they will continue to cover all immunizations that the CDC had recommended before this meeting. They'll cover those vaccines at no cost to patients. So I really think the key question is, what vaccines will federal programs cover? Right now, that's still to be determined.
CPR health reporter John Daly, thank you so much.
You bet.
A mother and her 7-year-old son are back in Colorado after spending nearly a month in immigration detention in Texas.
Cuando llegamos en casa de un familiar.
When we got to a relative's house, my friends from work were there. They gave us a welcome we didn't expect. It was only a month, but we missed them so much.
Solo un mes, pero nosotros nos extrañamos demasiado.
Carolina Suarez Estrada was one of many people without criminal records who have been detained in Colorado and around the country. She'd been working construction in Buena Vista and was handcuffed by ICE agents inside the local court complex last month when she took her partner in for a court appearance. Colorado Sun reporter Taylor Dolvin uncovered this family's story and is here to tell us more. Taylor, how did Suarez and her son come to be in Colorado in the first place?
Suarez and her son, Luciano, are from Colombia originally, and they came to the U.S.-Mexico border in 2023 and applied for asylum there. And they ended up in Colorado because they already had family living in the Salida, Buena Vista area. She got a work permit and had started a construction job recently.
So she took her partner in for a court appearance. How did she and her son then end up in detention?
She drove her partner to his court appearance for a recent drunk driving charge. And when they were leaving the court complex, an unmarked vehicle started to follow them, trying to pull them over. And she got really scared, and she drove the car back to the court complex, and she and her partner ran inside to the probation office and tried to hide in the office there.
And those were ICE agents that were inside that unmarked car following them.
Yes. So in body camera footage that I got of the arrest, you can hear one of the ICE agents, Benjamin Diedrich, talking to sheriff's deputies inside the probation office lobby.
We were attempting to arrest him. We know who he is. So.
You can hear Diedrich say over and over, since they ran inside, this is now a criminal thing for us. And so sheriff's deputies are asking if the ICE agents can wait outside where Suarez and her partner can't see them. After Diedrich and his partner go outside, Suarez starts pleading with a deputy inside. She asks, why are they chasing us? I only came to get him because he can't drive. But what ended up happening was the deputies told Suarez and her partner immigration had left. They weren't there anymore. And so they went into the lobby and waited. And eventually the ICE agents came back into the lobby and arrested them there.
In Colorado, local law enforcement is not supposed to do the work of ICE. Did the sheriff's office violate Colorado law that restricts how much they can help ICE?
I asked Sheriff Andy Rorich about this, and he suggested the office didn't actually assist ICE in the arrest. But he did say that since ICE claimed this had changed from an immigration arrest to a criminal arrest, that he was within his right to help ICE. As for ICE's actions, in the past, traditionally, people in Suarez's situation with a pending asylum claim and a work permit haven't been targeted for detention and deportation. But that is shifting under the Trump administration. We're seeing more and more arrests of people in this situation.
What about Suarez's son, Luciano? How did this 7-year-old boy get caught up in this?
Her friend actually picked up the boy from the babysitter's house and drove him to Alamosa to meet with his mom. And the next day, ICE transported the mother and son to a detention facility in Texas.
Taylor, you first wrote about this family when they were in detention, and then you learned that they were getting released. Do you know why they were released?
We don't know exactly why. That happened last week, and they arrived in Denver after a flight and reunited with a family member at the airport. I was there to witness that, and it was just a really emotional moment as they saw this family member they hadn't seen in a month, and they didn't know if they would see again.
I can imagine how relieved the family is feeling. How about other immigrants in Chaffee County? How are they responding to this story?
Immigrants that I've spoken to in the area are still very startled and scared. The day of Suarez's arrest, people who worked with her at the construction company actually fled her workplace at the construction company and hid in their homes for several days.
Todos tienen mucho miedo de salir a la calle. Y muchos de ellos tuvieron que correr.
The Buena Vista School District Superintendent told me that 12 likely children of immigrants missed the first and second day of elementary school that week. And Luciano is actually heading back to school today, and I asked him what it's like to be back at home.
Me gustó mucho jugar en el play otra vez. I really enjoyed playing my video games. Y me encantó mucho.
Suarez also plans to go back to work today, even though she has to wear an ankle monitor that keeps her from going more than 75 miles from Chaffee County.
Besides being heavy, it bothers my ankle. And also, when you're someplace, people's eyes go straight to the shackle.
She has an appointment with ICE to check in on the ankle monitor in November and is still waiting for a new court date for her asylum case. But in the meantime, she's really grateful to have life be somewhat back to normal.
At least for a time. Taylor, thanks for sharing the story with us.
You're welcome.
There's a restaurant in Denver where you can get a tasty meal and not pay a penny. Just listen to what's on offer.
So they'll have the option of jasmine rice or a creamy polenta. These are spicy fried black beans, collards, mixed veggies, and a peach and strawberry arugula salad.
Sounds amazing and also sounds a bit too good to be true, but somehow it is. And somehow this cafe has managed to stay in business for almost 20 years with this unique business model meant to serve everyone in their community. Denverite's Kiara Damari stopped into the same cafe on East Colfax Avenue in Denver. Kiara, how is this possible? How does this work?
So, Same Cafe stands for So All May Eat. That mission is made possible by a small staff and volunteers who keep the whole operation running, from the chefs to the servers and everyone in between. When you walk in, if you weren't reading the signs, you wouldn't necessarily realize that, though. You walk up to the counter and order as you would anywhere else. However, diners at the cafe can cover their meal in 3 different ways. You can pay whatever you can afford, you can volunteer your time, or donate produce. Chef Vasta is a plant-based chef and caterer who volunteers there once a month to prep and serve healthy meals.
I think food is a human right, and food is connection, food is to bring people together, and this event allows me to get to know my community and also give back to my community.
There are other places that have volunteers and that serve hot meals. Why does Same Cafe use this different model where it operates much more like a typical restaurant?
Yeah, so that part of being mostly like any other local cafe, where anyone can sit down at a table and order, is key to their mission. I spoke with Brian Nelson, who is a volunteer and board member of Same.
I found Same Cafe at the onset of the pandemic when I was actually in need of help feeding myself.
And Nelson said that the cafe allows people to eat with dignity.
It's something that I'm sure I wouldn't have understood quite as much had I not experienced that and needed a place where I needed to feel dignified.
Really beautiful. Kiara, you reported that the Same Cafe is branching out now to get food into people's homes as well. They're now providing no-cost groceries.
Yeah, so it's set up kind of like a small grocery store. Each Friday, guests can just stop by and pick up any items that they might need. That includes produce, snacks, and canned goods. And there's no payment or volunteering required. The produce that's available is whatever the kitchen didn't get around to using by the end of the week, so it also helps reduce food waste. And it's one more way to feed people who could use a little help.
Everyone's in a different spot, right? Sometimes people, they could be doing well, and then for a couple of weeks they could not be doing well, so it kind of gives people it's kind of like a safety net for a lot of people that, are just kind of struggling with day to day.
And Vazi, if you wanted to check out Same Cafe, it's open for lunch on weekdays, and it usually offers pizza, salad, and soup. But there are volunteer chef takeovers, like with Chef Vasta, once every month. And the menu will depend on the produce and food that's donated and, of course, the chef's imagination.
I definitely want to check that out. Thanks, Kiara.
Thank you.
You can find more information about Same Cafe at the link in our show notes.
A special thank you to Sean Lucero, and thank you for listening. To keep up on what's happening in your state, be sure to follow Colorado Today. I'm Arlo Perez Esquivel.
And I'm Bazi Kanani. This is CPR News.
Support for Colorado Today comes from Credit Union of Colorado. With access to over 30,000 ATMs and a mobile app, they're dedicated to offering the services of a big bank with a heart. Learn more at honestlygood.org.
Support for Colorado Today comes from Safeway. Their pharmacists are here to help, offering a wide range of vaccines including flu, COVID, pneumonia, and RSV immunizations. Visit your local Safeway or schedule online at safeway.com/pharmacy.